And your SOAP note's going to look a little different depending on what institution you're at, what system you have. Even Epic, which is probably the most commonly used EMR, can look different at every institution because you can customize it. Same thing with like your notes. So like our surgery notes are customized for our team. The ICU team has their own notes that they use. Even people within my team, our notes can look different. So as you go, you'll find what works for you and what works at where you're at for rotations or where you're working when that time comes. So I did a post-op day 2 note. So starting with subjective, I typically like to start it as like, what is the patient? What are they here for kind of thing? Because to me, if I'm reading someone else's note, I don't want to read through a ton of fluff before I know what's happening to the patient, if that makes sense. So I right up front put their post-op day 2 exploratory laparotomy with a small bowel resection and primary anastomosis. Okay. And then this might be what my subjective section looks like. Like I said, I tend to get a little creep of my objective information into there, but I think of it more as an interval history. Okay. So he's remained afebrile with stable vital signs. He remains NPO and has an NG dissection with 150 cc's of output. Foley was removed yesterday and he's voiding without difficulty with a urine output of 0.8 cc's per kilo per hour. He reports his pain is well controlled, rates it 2 to 5 out of 10 in the last 24 hours. That's something that you can find in nursing documentation. He reports he has not been out of bed due to his lines and tubes, but has passed fletus. Okay. You can get into more detail there with like, he denies shortness of breath, chest pain, those types of things. But I did those in my review of systems here. So I didn't kind of do it twice, if that makes sense. Okay. My actual progress notes that we do don't have a review of systems section. So anything that would be like new or should be in a note, I would have had put in my subjective HPI. We don't have a review of systems within the progress note. Not that you shouldn't ask those questions to make sure something new hasn't come up, but you may find that once you're on an EMR system. So every day when I see a patient, I review allergies, and I make sure I click that I reviewed them, especially before I put any orders in for medications. And then any hospital medications that they're on should also be in your SOAP note. And so my EMR pulls those in automatically into my note. And so there's a section that shows all of the medications that they received, that they're receiving currently. And it pulls it right into the note. Same thing with my vital signs, they get pulled in, except it's the most current ones. So I tend to go back and take a screenshot of my 24-hour, like minimum and maximum vitals, and I put that in my progress note too. Same thing with I's and O's, those get pre-populated into the note, which is helpful. So this patient's on IV Tylenol, a morphine PCA. I didn't get very specific here, but when you guys do your notes, be as specific as you can with these things, just for, it's helpful at this stage. Zofran, Lovenox. A lot of progress notes don't really have like a whole lot of past medical history in the progress note. You're going to see that more in like your H&P or your initial consult note. But if something's pertinent to what you're doing that day, it's not a bad idea to have that in your note too. Same thing with social history, usually going to be more in your H&P consult note and not so much in daily progress notes. But if there's something that, you're thinking about this patient going home, what type of support does he have? That might be something that you get into more that day and then you document it. Okay. For the case of your assignment, those things are required. So make sure you're looking at the rubric closely because it outlines what should be there. So review of systems. like I said, it's kind of, they're not always something that's in every progress note template. But there are things that you should be asking, and if it's not there, then you just document that in your kind of subjective portion. So thinking about things, that I would want to know, like post-op, do they have any new weakness, chills? Are they sleeping okay? How's their pain? So those are kind of general things to ask. And then starting to think about those complications we can have. So do they have a cough, shortness of breath, any pain when they take a deep breath? Those are important to know. Cardiac, has, chest pain. Are you having any palpitations? Any swelling of your legs, feet, and then nausea, vomiting, abdominal pain would be something that's pertinent. Thinking about UTI, any pain when you pee, any blood in the urine, headache, dizziness. So your review of systems, try to make it pertinent to what is happening with your patient, if that makes sense. Okay. And I believe your assignment calls for 6 systems. I was looking at the rubric earlier today. I believe it says 6 to include with that. Someone mentioned the rubric doesn't specify meds or allergies in the subjective. I thought that it did, but I will double check. If you follow the rubric, that's what I'm following to grade. So just follow that closely. Okay. Objective. So we talked a little bit about how I like a 24-hour kind of min max for my vitals, but a billing component of a SOAP note is that you have the most recent vitals in there as well. So I tend to have both in mine, where the most recent are pre-populated in my system, but then I also put in a graph of what their minimum and maximum were, just for a 24-hour overview. Okay. As far as their exam goes, you want it to be pertinent to what's going on. Okay. So like we kind of talked about earlier, like I'm not looking at their skin to see if they have an abnormal mole that they need to see dermatology for, things like that. You want it to be pertinent to what's going on. So for me, every patient gets a general, they get a neurologic, and that can be as simple as they're awake, they're alert, they're oriented. Okay. Now my trauma patients, they get more specific neurologic exams where I'm testing cranial nerves and all of the things. But on a typical surgical patient, unless I have a issue that I would need that information for, I wouldn't do that. Always listen to heart and lungs. Okay. In this patient that is in abdominal surgery, we're going to examine the abdomen closely and make sure that we comment on the incision, what type of incision it is. And then if you just say it's intact and you don't say there's erythema or drainage, when someone looks at your note, they don't know if you looked for those things. So just think of it that way. If it's not documented, it didn't happen, kind of thing. Okay. I like to know that they're moving all extremities. They didn't have some type of neurologic event that now they can't move their right arm. And then thinking about those things that can cause a complication, checking their legs for any edema, any calf tenderness. Okay. And then your objective, like we talked about, would also include any new labs or imaging in that last 24-hour period. So in a patient like this, they probably had a daily CBC and a BNP. So I would include those here. EMR systems have nice like drop-down list. You can click labs in the last 24 hours and it'll import it into your note for you so that you don't have to free text it all. So there's lots of nice tricks that come with an EMR system. But things that I would want to know on a surgical team from a CBC is usually their white blood cell count, their hemoglobin, hematocrit, and their platelets. The rest of it I don't get into a whole lot. So that's why I only included those 3 things there. And then their electrolytes. All right, assessment. So when you guys do your assignment, part of the assignment is that the patient has a fever And so you'll be thinking about how to work that up and including that in your assessment and plan. I did not do that here. Mine's more of kind of general, he's doing well kind of assessment and plan, but make sure that that's included in yours, okay? And so like we talked about, I like to put my, what is his actual reason is he's here. And then I do my plan for a patient like this in a systems-based manner. It helps me make sure I don't miss anything. And typically when I'm writing my note, I have my note up on one side of my screen and I have my orders on the other half of the screen. And I make sure that what is in my note matches what's in my orders. So, here I say he's on IV Tylenol every 6 hours. Check my orders, make sure the IV Tylenol hadn't expired and fallen off the list or something. Because those things happen, or maybe the person overnight got rid of the IV Tylenol. And so it's really important to make sure what you want is still what's ordered. And so I like to have them up at the same time. That way I'm making sure it's consistent. Okay. And then kind of I just go down the body. So respiratory, cardiac, GI. So in this patient, because his NG output's going down, we're going to clamp it and then hopefully take out the NG. What medications we're giving him. So Zofran is needed. His IV fluids. We talked about like PT being important in these cases. Heme and ID. Sometimes they're separate in a systems-based plan, sometimes together. You'll see a lot of different variations. That's okay. And then I like a tubes, line, and drain section. So I can keep track of what all tubes, lines, and drains he has. That way we're not keeping something in longer than we should be. And I like to say when it was, so like he had a Foley taken out yesterday. That way, if he starts to have urine symptoms in a day or two, someone can look back and be like, oh, his Foley came out on the 21st. Okay. And then I always at the end document who I talked to that day. So in my case, I'm taking care of pediatric patients. I usually document that I discussed the plan with the patient, the family at the bedside. Sometimes if I talk to the bedside nurse in detail, I'll document that I talked to them. Any consultants that I talked to. So if pain management is involved, I discuss the case with pain management. That is a couple reasons that, remember your notes are not only documentation for the next person to know what you did, but also a legal document if a case would go to court. And so the more that you have in there that you did these things, the better. The more that you're doing those things, the higher you can bill as well, because it's showing you're taking more time on the patient. So I tend to document those. And then also if you tell the patient, hey, you haven't been out of bed, we really need to get you out of bed, those types of things, that conversation is important to document that you had that conversation with the patient. Okay. And then your note should always include some type of discharge statement. So his timing's unclear at this time. He's still admitted because he needs IV medications, nutrition support, and safe mobilization. And so you can be specific about why they're still there. That helps with planning. It also helps when insurance is saying they should be home by now. I don't want to pay for another hospital day. Having those things in your notes supports them still being there. Okay. And then this is kind of what we talked about earlier about, he's progressing as expected. This kind of section down here describes that. So he's progressing as expected postoperatively. He's having bowel function. We'll attempt to remove the NG today and start clear liquids tomorrow. We'll also work on ambulation with assistance from PT. So that kind of justifies that he's progressing how we would expect, if that makes sense. Does anyone have any questions on that? And your SOAP note may have more than one problem, kind of how the last one you guys did. Just kind of make the plan and the problems makes sense as best you can within the system. Can you send a copy of the SOAP note? I'm trying to figure out how to actually download it as a PDF. I don't know if I have the same options you guys do, so I'm working on that. Kayla?
So if you go and you like go to closed section at the top or session at the top,
Okay, yeah,
then it'll give you like the three tabs again. And then
okay,
the last tab says like download progress or
got
something.
it. Okay, I
You
had not
download
closed
it.
the section yet, so,
Yeah. So
okay,
it
perfect.
should be there.
Thank you. Yeah, I'll do that and I'll send it to you guys as a reference. Okay. All right. Perfect. I had a couple more slides that I wasn't sure we'd get to today, which is totally fine. We'll jump on those next week with like ICU transfers, which plays well into next week's material anyways. So I hope that was helpful. If there's questions on notes, let me know. Like I said, I'm working through your last assignment to get those grades out to you guys and get the feedback back to you. Okay.